Hi, welcome to another Facebook Live with Veterinary Referral Center of Central Oregon. I'm Jen Bentley, the dermatologist here. I've got our special guest, Dr. Taylor Stockdale, who is our ER doctor, and we have a very timely topic again. We're going to be talking about chocolate toxicity, and it's a good time to bring this up with Halloween coming up this weekend as a good reminder of why we shouldn't allow our animals to get into chocolate. So I will go ahead and start off with the first question, but please keep in mind this is a discussion. So if you guys have any questions, please chime in. Denali will be taking your questions. We've also got Shelby back there on the camera, so we are ready for a good discussion on this topic. But I guess what always goes through my mind is if your dog or cat gets into chocolate and they just happen to eat a bunch of it, or you don't know how much they ate, what is the first thing that owner should do?
So I think getting more information is best. So calling either us, we're here 24 hours to answer phone calls, or you can call one of the poison hotlines. They usually have really good information if you can provide them with some of the pieces of the story, like a rough weight of your dog, what type of chocolate, how much chocolate. Usually we can piece together from that how worried we need to be and what the next action should be.
Right, because it can range from, oh, you're fine, you don't need to come in, to, oh my gosh, get here immediately, we need to do major treatment to save your animal's life.
Absolutely,
right?
Yeah, there's such a wide range of the types of chocolates and how much the dog can get into that treatment is really variable, and we are always happy if it's a tiny amount and we can say, oh no, your dog's going to be just fine. So it's always worth a call first.
Right.
But if you're worried, you can always just show up and we can talk and do an evaluation here too.
Awesome. And as far as there are so many different chocolate types and so much out there, and that's why it gets very hard, I think, to say, oh, here's your general recommendation that this is too much. It just depends on the size and that chocolate type. Is it true that white chocolate is okay, or is there a time when it's not okay, or it just varies with that too?
It's a trick question. So
okay.
There are the toxicity that we think about from chocolate is usually from theobromine, which is in the caffeine family. It's a stimulant, but white chocolate doesn't have as much theobromine and usually not enough to cause a problem. But white chocolate usually has more sugar and is actually richer oftentimes. So we get the secondary side effects from gastrointestinal upset from the white chocolate. That's more than the
like
stimulant.
White chocolate a lot.
That's why it's around often. And the types of chocolate really vary. The stimulant in there is usually related to the amount of cocoa. So if you have milk chocolate, it's much less toxic. It takes a much larger volume to cause a problem than the 70% dark chocolate, or especially the baker's chocolate or bittersweet chocolate. Those tend to have a lot of the toxins in them.
Okay, all right, perfect. So it kind of goes white chocolate, milk chocolate, dark chocolate,
exactly.
Baking chocolate is that spectrum.
Yeah.
Is there like any general kind of saying, oh, if you're a lab and you eat this much milk chocolate that you have a problem, or it's just you gotta call in?
It's
and
really
know?
case by case. It's an individual animal and different types of chocolate, whether it's a Hershey's bar or a Reese's cup or whatever it is. It really, there's so many factors that it's best just to call. In general, probably one chocolate chip is not going to hurt a dog.
Yeah.
And one small piece of milk chocolate for most dogs would be okay, but if you have a dog that's got a sensitive stomach, then you may end up with more of the pancreatitis issues and issues with inflammation in the guts than the actual chocolate toxicity.
Interesting. So tell us a little bit about pancreatitis. It's a word that goes around a lot, I think. Maybe some people don't quite understand what that means, but if you want to just give us a general...
Sure.
Yeah.
So the pancreas is one of our organs in the abdomen that dogs have as well, and it secretes a lot of the digestive enzymes. The time we run into trouble often is when it goes into overdrive because you've just eaten something that's too rich, too fatty, too sugary, too much basically, and it goes and produces all of these digestive organs, and it can itself develop inflammation, and that's where we get the term pancreatitis from. So inflammation within the pancreas, or pancreatitis, is what we can see cause a lot of secondary issues. It is a reactive organ, and it causes irritation to all the organs it lives next to in the abdomen, so the stomach, the small intestine, the colon.
It's like a bomb.
Yeah, it goes off, and then we get secondary side effects like vomiting and diarrhea and nausea, and hurts. People that get pancreatitis say that it's really a very painful thing. So it's what ends up needing a lot of the treatment, especially if it was not so much a high cocoa dose, but more just the sweet sugar and fat that's rich for the dogs.
Interesting.
And the spectrum on there is huge. Yeah. Some dogs would do okay, like your garbage gut labs are oftentimes just fine.
I love
Yours
that
and mine both.
Yeah, exactly.
Other dogs, they can be really sensitive to it and end up needing to be in the hospital for several days.
And if you're just joining us now, we're talking about chocolate toxicity, and one of the side effects actually of eating chocolate is what we just discussed, pancreatitis. But tell us a little about the other side effects actually from the theobromine. Got it.
Yeah, so the main
can
thing
happen.
we think about theobromines in the stimulant family. So you can think of it kind of like caffeine and an overdose of caffeine. So the big things that we start to see are hyperactivity, agitation, and it can progress to arrhythmias within the heart or seizures or tremors. And in really severe cases, I have seen pretty bad arrhythmias that can occur in the heart that do require treatment. And that's where we end up getting the more sort of life-threatening immediate problems. Those symptoms can start to show up within just a couple hours of eating chocolate, depending on how much cocoa they got.
Okay, all right. And what are the treatments for this? So obviously it's going to range based on the toxic load, but what are some of the things that we do here at Veterinary Referral Center to counteract the arrhythmias and decreasing that chocolate load on these guys?
So the big first treatment with any toxicity is decontamination. So first we start, if you can get your animal here quickly, we can usually induce vomiting, especially in dogs, pretty reliably to remove some of that toxic load and get as much out as possible.
How quickly, ideally?
Usually if it's within 2 hours, I'll try.
Yeah.
That we start to not get as much bang for our buck. But within 2 hours, I think it's usually worth giving the shot of inducing vomiting.
Okay.
Because usually I can still get up a very chocolatey smelling vomit from those guys. And then we'll never be able to get all of it up, of course.
Right.
So usually the next step to decontaminating is giving the substance activated charcoal. And that is a liquid charcoal that we use here. It's got a specific dose because it comes with side effects if you give too much. But it will go into the body and try and absorb whatever's within the bloodstream and residual in the gut. So it can be really helpful, and sometimes they need multiple doses of it as they metabolize it, and we want to absorb the byproducts as well.
Right, because it circulates, right, from the liver back to the gut, back up to the liver, gut, and so it can just keep cycling there.
Exactly. So usually we'll do multiple doses to catch that intrahepatic recirculation, so it's called. So that's the main part of decontamination. And then for more severe cases, I usually keep them in hospital on an EKG so I can monitor their heart rhythm and rate throughout the night and treat with specific antiarrhythmics as needed. Depending on the type of rhythms, it varies which antiarrhythmic we use, but we can use medications if they're here and can visualize it. And then IV fluids to keep flushing their system and get everything else out that might be residual in their blood work.
Okay. If you guys have any questions about chocolate talk, please let us know. I do have one more that maybe our viewers are interested in too, and that is inducing vomiting at home. Should you do it? Should you ever do it? What should you do it with? Is it ever okay?
So there's different answers from different people. Personally, I don't recommend inducing vomiting at home. There are some doses that you can use hydrogen peroxide, and there are some poison control hotlines for pets that will recommend trying it. In my experience, I've seen a lot of complications from it, and then ulcers within the stomach, and we end up with more problems from the hydrogen peroxide than we did from the initial toxin.
Yeah.
So here, in my opinion, I think it's just not a safe way to go. We have such good options that are safe to induce vomiting in dogs that I recommend using that instead.
Yeah, some pretty easy ways to do it.
Yeah, it's very easy, really pretty low risk, and almost all dogs respond to our injection that we use to induce vomiting here.
Yeah.
So.
A little bit about, there have been some owners recently who said they can buy activated charcoal, which is used for that decontamination at, I don't know where they're getting it, but is that something that owners can use? Do you recommend that?
You can find it online. It's not a prescription or anything. I don't recommend it, again, because of the potential complications. It is a medication for all intents and purposes, and you can get pretty severe side effects because it's so high in sodium, and that changes your electrolyte balance and can cause seizures even in dogs.
Okay.
So you really have to be careful with it and know the right dose and how frequently to give it. So it's not something that I recommend doing at home. I also, there's some capsules of it. We use the liquid here that's made for pets, and the capsules don't work like the liquid does, so I don't recommend those either.
Okay. All right. Thank you. And I guess, chocolate toxicity, it seems to be fairly common, and I went to one of the poison hotlines just to see how common it was, and they were saying about 10% of their calls was due to chocolate. Do you think that's in toxicity range? That's probably about what you see, or more or less?
Yeah, maybe even more. It's definitely seasonal.
Yeah.
So around the holidays and Easter, we get a lot of chocolate toxicity. The one thing I think is people know that chocolate is toxic to dogs, so it's something that even sometimes it gets reported more because they know that they're not supposed to get it. One thing that I see oftentimes around the holidays especially is gifted chocolate. So you or I will get a package from somebody in the mail that's all wrapped, and we'll go to put it in our pile of gifts for the holiday, and we don't know that it's chocolate, but our dogs know because they smell it, and they will get into it and eat all of it. And so that's one. But if you can try and maybe keep packages out of the way of animals, that helps a lot during the holiday season.
That's really good advice. I wouldn't have thought about that.
Yeah, they smell it.
And it's so easy to just put the package like on the low counter, and then poof, it's gone. Any other stories of dogs getting into chocolate and different ways, or just kind of?
Most of it's human candy that they've stolen. Definitely having children makes it easier for the dogs to get it because it's everywhere. And then another common question that we get, or that we have had issues sometimes with, is when they ingest, especially the bite-sized candies, all the wrappers. And I have never seen a dog actually get a GI obstruction from those wrappers. So usually those ones are ones that I like to keep in the hospital, even if the toxic dose, because it's essentially a foreign body. So we keep them on IV fluids, try and lubricate the guts as well as possible, and try and move everything through. I've always been successful with that, but it's one thing to think about too, is just the foreign material within the gut.
Yeah, it's awful. So it's so much more to think about than just chocolate toxicity. There's pancreatitis, there's potential foreign body, but usually we don't actually see it cause an impaction. So a few other things to worry about on this list of things besides just chocolate toxicity. That's unfortunate. But, you're in good hands, obviously, if you do happen to have this incident happen. And if your dog or cat gets, that's a good, have you seen any cats?
I don't think I've seen cats.
Yeah, I don't think I've ever seen
Usually
a cat
around
with it.
this time it's ribbons and tinsel that cats like to get.
Ribbons and tinsel. We should have another one about that.
In a month or so we'll talk about that.
But if you guys in that unfortunate situation where your dog eats some amount of chocolate, it's important to know what kind of chocolate they ate. Try to figure that out. See how much they ate. Try to get a good gauge of that, and call us here, and you'll be able to talk to a technician or doctor on the phone to let you know how much to worry. Or you can also call the Pet Poison Hotline. We'll post that on Facebook too. They're a great resource. Have so much information here. We work with them a lot on cases too. Some of the chocolate toxicities are easy to figure out, but some of them, when they've eaten like very random types of chocolate, it can be a little bit different, and that's where we'll call the Pet Poison Hotline too. But please let us know if you like this Facebook Live session. Give us a big thumbs up here. Let us know what other topics you would like to hear about. And as always, we will be here every 2 weeks at 4 o'clock on Wednesdays. Thanks.
Thank you.